Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. I thank the committee for the opportunity given. I will present my research entitled Evaluation of Feeding Practice for Infant and Children, PMBA, for Stunting Children in Lombok. Introduction. West Nusa Tenggara is ranked 7 as the province with the highest prevalence of stunting in Indonesia. Stunting is a chronic nutrition problem. It will affect the quality of human research. Stunting is short stature, height or length not suitable for age. This is due to insufficient nutritional intake or poor health. In other words, stunting is a problem of failure to thrive. Feeding practice for infant and children, PMBA, is one of the specific nutritional interventions that can be carried out to prevent and overcome stunting. MPAC is not only related to food availability, but also include the accuracy of acts of feeding, frequency of meals, number or portion of food texture, type or variety, feeding, and hygiene. This study used a cross-sectional study design. Structure interview used a questionnaire to see the characteristic of infant and children feeding in mother or caregiver of stunting toddlers aged 6 to 24 months. Respondents of the study were certified mother of stunting infant, who were selected using purposive sampling technique. Result and discussion. Most of the parents of stunting children under 5 have low income. The father education is medium, the mother education is low. Household income standard based on people minimum wage standard in Lombok. Low education of father and mother give a risk of stunting in toddler. Mother with low education have an influence on the incidence of stunting in toddler with 1.67 times compared to mother with higher education. Toddlers in low-income households have a risk of experiencing stunting by 2.1 times. Low household income was identified as a significant predictor of stunting. Description of feeding for stunting toddlers. Accuracy of feeding aids for stunting toddlers. Most of the stunting children under 5, 80%, were given complementary food at the right age. This is not in line with a large number of studies, which states that there is a significant relationship between the initial age of complementary feeding and the nutritional status of children. Feeding frequency in stunting toddlers. The frequency of eating is the amount of food daily, both qualitative and quantitative. In the study, 77.1% of children under 5 who were stunted from mothers who attended the PMBA class had a frequency of 3 meals a day. Amount of food in stunting toddlers. Almost all of the amount of food according to age and portion of children under 5 were left over, 74.3%. The amount of leftover food affects the amount of nutritional intake that enters the toddler's body. Accuracy of stunting feeding texture according to age. The texture of food given to stunting children was mostly age-appropriate, 85.7%. The mother of a toddler has a good knowledge of the right food texture according to the age of the toddlers. Diversity of food in stunting toddlers. The menu in one meal consists of 2 types of food only. The most commonly consumed source of animal and vegetable protein are eggs and tofu. The lack of diversity in food for children under 5 has significantly caused stunting. Several studies have shown that significance between dietary diversity, especially protein source, and the incidence of stunting. Method of feeding and hand hygiene for stunting mother or caregiver for toddler. The way of feeding was mostly done by hand, which was 74.298%. Feeding by hand can be a risk factor for infection in children under 5, which will also affect the nutritional status of children. Most mothers of stunting children under 5 have a habit of not washing their hands before eating using clean water and soap. The results of this study indicate that most of the stunted children under 5 have a picture of a diet where the amount, variety, and hygiene are still inaccurate. In several previous studies, these three factors significantly affected the incidence of stunting among children under 5. Conclusion: the feeding rules for stunting toddlers are still not in accordance with PMBA guidelines. The age, frequency, and texture of the food are appropriate, but the amount, variety, and hygiene are still inaccurate. Suggestion: for the next research, it is necessary to carry out further research on other factors that affect the nutritional status of children under 5, especially under 5 years of age, with an analytic approach so that a significant relationship can be found between the factor studies and the nutritional status of children under 5. Thank you very much.